Welcome back to CBS News 24/7. All right, happening right now. The President of the United States and leaders from drug maker Pfizer are speaking from the Oval Office. Let's listen in on their deal.
The COVID, he did a fantastic job with a lot of things. He's a leader, and Pfizer is right at the top. You know, it's there. Eli Lilly has been fantastic also, your friend, my friend. And they're all coming in over the next week. We're making deals with all of them. And I said, if we don't make a deal, then we're going to tariff them an extra 5, 6, 7, 8%, whatever the difference is, and we'll take it that way. So we took away the advantage by the fact that we have tariffs. We took away the advantage that they would have of just saying no, and we couldn't do anything about it. If they do that, what we do is we'd put a tariff on them of an equivalent amount, and we take it that way. And nobody wants to play that game. So they're going to be, they're all going to be good. We didn't have to mention that to Albert. Well, maybe I whispered it to him very slightly, you know. We had to give ourselves a little bit of an advantage. But no, but the tariffs played a big role because they know that's what's going to happen.
President Trump. You mentioned the tariff, the exemption of the 232s, but can you share a timeline for when we can expect the results of that 232 investigation?
Let Howard answer that question, please.
Sure. So while we're negotiating with these companies, we're going to let them play out and finish these negotiations because they are the most important thing to the American people. So we are standing by, helping and working with them. But the driver of the 232 outcomes is our HHS team because, I mean, look what they've accomplished today. So we are on their side helping them, but that is the model that's going to drive.
And you have to understand, Albert's spending $70 billion that he wouldn't be spending because of the tariffs, let's say, and other reasons. I think he liked the winner of November 5th, in all fairness, but because of the tariffs. And that wouldn't happen. He's not going to pay any tariffs because when he moves here, there are no tariffs. So he won't be paying tariffs. That's the beauty of it. If you move here, there are no tariffs. And we have over $17 trillion, Albert. You believe these numbers? So Biden had less than $1 trillion for 4 years. We have over $17 trillion for essentially 8 months. Pretty amazing.
When will prices come down, Mr. President? When can America?
They're going to start coming down. Drug prices? Well, they'll be starting immediately. Yeah.
President, can you speak to what impact you think this reduction in drug prices will have on midterms coming up?
I think it's going to have a huge. I said, if we can pull this off before midterms, I've wanted to do it from the beginning, from my first day in first term. And we were doing so well. We had the greatest economy we've ever had. Everything was good. And then we're ready to do this, which is complex and big. It's a big change. But what happened is COVID came, and we focused on COVID. We focused on COVID very hard with Albert, with the other companies, with everybody. Regeneron was a great thing. You know, we did a lot of therapeutics that were fantastic. And so we focused on that. And I said, if I pull this off again, the first thing I'm going to do, and, you know, we've been working on this for 8 months. It's a very big deal. This is a big shock to the system. But it's not as much as I said. They're going to go up. The world is going to go up a little bit. We're going to come down a lot. But now it's fair. We're going to be paying the same thing. Yeah.
President Trump, in your first term, when you cut the price of insulin, Biden later came in and tried to steal credit for that. Do you worry that the Democrats are going to try to steal credit for these historic cuts?
I really appreciate your question because I did. I cut the price of insulin down to $35. And the problem is with many of these things, now in this case it's going to be pretty quick, but oftentimes you'll do something medically because of the process, and it won't be seen for 2 or 3 years. That happened also with, I could say 4 different things, but just if you talk about insulin, so it was 200, 300, 500, and you couldn't get it, and I got it down to 35. And I said, I hope I win the next election because otherwise whoever wins is going to take credit for it. Well, what happened is we did win the election. We did great. But unfortunately, it didn't work out that way from a practical standpoint. And Biden, when I saw him get up and take credit for the $35 and even less insulin, that was 1,000% lower than what it was just previous. Boy, I tell you, I didn't like it. So I did the best I could to let him know we did it because we want to be given credit. But we are the ones that got insulin down to that number. And you're right, they tried to take credit for it. They had nothing to do. In fact, they didn't even know what happened. All of a sudden, the insulin price kicked in at $35, and they asked Biden about it. He had no idea what the hell they were talking about. But after they explained, and they didn't really explain to him because he was not capable really of understanding it, but when they went out and talked about it, they acted like it was a great feat by Biden. It had nothing to do with him. And it continues, and we'll get it down even further. But insulin was, people weren't taking it, I would imagine. They couldn't take it. God bless you, Bobby. I hope I didn't catch COVID just there. Don't you have Paxlovid? What is it? He's got Paxlovid. Give me a Paxlovid immediately.
While Nancy Pelosi is ignoring what you're doing for the American people, she's going after your administration for cutting taxpayer-funded health care for illegal aliens. Last night, Nancy Pelosi, she went on NBC last night, dropped a bunch of F-bombs, told Republicans to go F themselves. Has she lost her mind?
We have done an unbelievable job medically. Just this, if you did nothing else, we've done a lot like the insulin. But just this, nobody can ever catch this. This is the biggest price reduction times, maybe 10 times, 15 times than has ever been given before. And this is going to have a huge impact. You know, as I said, Obamacare is not a good thing. It's been bad. And I'd like to make it better. I told them, I spoke to a lot of people, a lot of Democrats recently. I said, why don't we change it? We can make Obamacare much better. We could come up with a new system that would be much better, less expensive for the people and better. This is maybe the biggest breakthrough because, you know, when you're talking about the prescription drugs, that's a big part of it. So we're going to look. This is prescription, but we're going to be looking at that. We could come up and through this whole thing, you know, because I don't know, we'll probably have a shutdown because one of the things they want to do is they want to give incredible Medicare, the Cadillac Medicare, to illegal immigrants. And what that does is it keeps them coming into our country, and like they do in California. And no country can afford that. No country. And we have the border stopped up. We have it closed. We have nobody for 4 months. Zero people came in. That wasn't me. That's by the authorities who happen to be liberally oriented. But just think of that. We have people offering health care to people all over the world that they can't afford to pay. And that's the Democrats. And what that does is it brings people into the country because they want to come in for the health care. But no country can afford it, and they can't afford it. So we cannot allow them to charge tremendous amounts of money for health care for people that aren't even citizens. And in many cases, they come in from prisons, jails, and mental institutions. And we can't let that happen. So we have a big fight over that. We have a fight over open borders. They still want open borders. We're having a fight over men and women's sports, if you believe it. You would have thought they would have learned that it's not a good issue. And we have a fight in transgender, as you know, transgender for everybody. And that, when you talk medically, that's a lot of money, too. That's a lot. Those operations are...
All right, you are listening to President Donald Trump with Health and Human Services Secretary Robert F. Kennedy Jr. and Dr. Mehmet Oz behind him, making an announcement on some major deals to happen between the United States and drug maker Pfizer. So let's bring in CBS News White House reporter Aarron Navarro for more on what we just heard. Aarron, what are the takeaways for you?
Yeah, Reed, just one quick non-medical related line the president had there. He said, quote, "We'll probably have a shutdown." I think that's interesting. It's not different from what the administration has been saying going into midnight tonight, but him saying it outright there was notable to me. He talked about this deal with Pfizer for them to offer their prescription drug prices through Medicaid at a lower rate. You heard from the Pfizer CEO say that there will be a 3-year grace period for them where they will be free from any tariffs imposed by the Trump administration as long as they follow through on their commitment to reestablish manufacturing inside the United States. And you heard the Pfizer CEO say at one point that he is glad he can, quote, put this behind us and focus on things he wants to spend his time on, such as cancer treatments or better obesity medicines and vaccines. The drugs will be at this lower price through, quote, supplemental rebates, according to graphics shared by the White House. And President Trump said that these lower prices will go into effect, quote, immediately.
All right, Aarron Navarro with the takeaways from that. Certainly a lot more to talk about that came out of that news conference. We'll continue to watch that on CBS News 24/7.